from birth to death. And so as you look on the left, you can see those are some of the things, or some of the areas that nurses work. So neonatal nurses work very closely with all the tiny, tiny babies, making sure in the neonatal ICU that they make it home. School nurses that cover thousands of students, military nurses, community nurses, hospice nurses, really want a good hospice nurse, very important role. Flight nurse, transport, and then those that were in occupational nursing. On the right-hand side, there are the nurse researchers. We have nurse anesthetists, clinical nurse instructors. It's very important for us. We have master's prepared nurses who take our students to the clinical areas, and they practice with them, and they teach them really how to take care of patients. The simulation specialist, I highlighted that because it's really very important. Sometimes we take students, let's say, for example, for the labor and delivery, and it might be the time that it's their time to have a clinical experience, but nobody's giving birth. So it's possible that the students might finish their clinical rotation in labor and delivery and never see a delivery. So in a simulation, we have a simulator that actually gives birth. So the baby comes out, the whole process with the placenta and everything else. And so the students get to participate in these case scenarios and simulations so that they know how to take care of patients when they are in that situation. Nursing informatics and the impact of all the electronic medical records and anything else that has to do with computer and how it has impacted care. And nurses are also policymakers, lobbyists, and politicians. This is just an example of some of the information explosion that has happened in all the professions, including in nursing. Where you could see the orthopedic nursing, nursing and ethics, forensic nursing, gerontological nursing. So every specialty has sometimes several journals. So demographics. So the average age of the nurse is 47 years old. So you'll see a lot of nurses reading medications with reader glasses. There are 37% have BSN degrees and 36% have associate degrees. Only 3 out of 5 nurses actually work in hospitals, and so there is a move and there is a shift more into the community and home health care, as you'll see. Males are about 11%, but it's very nice as I looked at the demographic that 40% of them are nurse anesthetists and about 33% of them are military nurses. In Ohio, there are almost 180,000 nurses, RNs, 60,000 LPNs, and about 15,000 advanced practice nurses. All the advanced practice nurses have to get recertified every year. And all the nurses get their license every 2 years, and they have to have so many continuing education credit. And the Ohio Board of Nursing oversees all of nursing in Ohio, education and practice. This is what we look like in comparison to the rest of the country. We're in the blue, and we have 1,081 registered nurses per 100,000 of the population. So actually pretty good. There are only 8 or 9 states that have that many nurses per 100,000 of the population.